We'll focus on research on sustainable development. So first, let me take you to the journey of what are SDGs actually, and then we'll focus on how we can do the research, focusing on the sustainable development goals. So if I talk of the sustainability, everyone knows that there are 17 SDG goals that have been defined by United Nations. So all these goals can be divided into three categories, we can say, which are kind of pillars for the sustainability. Am I audible to all?
Yes, ma'am, you are audible, ma'am.
Okay.
I request the participant kindly mute yourself.
So if I talk of the pillars of sustainability or categorization of the sustainable development goals, we come across three keywords, which are social, environment, and economic. So there are certain SDGs which are related to the society. We call them under the social category. Certain SDGs are related to environment, and some are related to economic scenarios. So though on the whole, they are combined into one, but still for our own purpose, we can do the categorization. So you can identify your area of interest if you want to contribute into the environment, or if you are from the humanities background, you can go in for the economic, SDGs, or if you want to work on the health sector or other societal related issues, then you can work on the social one. So first thing is identify that on which pillar you would like to contribute in this. So once you do that, so there are three pillars, and social, economic, and environment, right? So I've put certain arrow onto this because this good health and well-being is somewhat related to the field on which most of the participants of this FDP might be working on. So we categorize the SDGs into three major pillars. So SDG 1, 3, 4, 5, 11, and 16 are focusing on the contribution to the societal values. And then comes across the economic SDGs, which are SDG number 8, 9, 10, and 17. And if I talk of the environmental, then SDG 2, 7, 12, 13, and 15 are focusing on the environmental related issues. So based on your interest area, your expertise, you can choose any one of the pillars in which you can contribute. So I have focused on SDG 3 because I'll be quoting examples of SDG 3 only, that how you can go about the research in that. So when I talk of SDG 3 goal, you can check from the site of UN SDGs website. You will find certain goals. All 17 goals are there related to a specific SDG. So SDG 3 has a specific goal which is focusing on good health and well-being. Now, if I say the good health and well-being, there are certain factors onto that. So the goal that needs to be achieved in this is that we have to ensure healthy lives and promote well-being for all at all ages. So that is the motto for the SDG 3, which is the major goal of SDG 3. There are certain data points that are given over here. So you can see those data points onto the UN SDG website as well, where they have given certain numbers which are of concern to all of us. Right. So we'll be focusing onto this. Then there are certain targets under this SDG 3. Now, if I talk of goal, we have already discussed the goal is the health of all the people at all ages. So under SDG 3, there are certain targets that have been fixed. Now, these targets are categorized. There are 9 targets, and then there is a framework on how to achieve those targets. So SDG 3 goal of SDG 3 is focusing on 9 different targets that have been defined by the UN. And there are certain frameworks that how we can achieve this. That is also a part of target only, which has been marked, on these 4, 3A, 3B, 3C, and 3D. All these are the frameworks. So we'll go one by one, and then you can take a call that on which particular target you would like to contribute. Now, these all targets are leading to the data points by year 2030. Okay? So there are 9 targets we focused on. So the first target is maternal mortality. Now, there is again a target given by the UN under the UN SDG 3. The target 3.1 says that we have to reduce the global maternal mortality ratio to less than 70 per 100,000. That means 1 lakh of lives. Okay, so that we have to achieve in year 2030. Then target 3.2 says neonatal and child mortality. Now, this target quotes that by 2030, we need to end the preventable deaths of newborns and children under 5 years of age. And with all the countries would be aiming to reduce this neonatal mortality to at least as low as 12 per 1,000 live births. And under 5 mortality to at least as low as 25 per 1,000 live births. So these are the targets defined by UN till 2030. So target 3.3, all these targets are again a goal 3, which is SDG goal 3. So target 3.3 says infectious diseases. We have to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases. And we have to combat hepatitis, waterborne diseases, and other communicable diseases by 2030. So this is the target. If I go to target 3.4, it is about non-communicable diseases. That says that we have to reduce by 1/3 premature mortality from non-communicable diseases, where target 3.1 was related to the mortality, maternal mortality. Target 3.2 and 3 were related to the diseases. Now 3.4 says that non-communicable diseases, we have to reduce the premature mortality from non-communicable diseases, right? This is with the help of treatment and prevention, right? So we have to reduce it by 1/3. If there is a target 3.5, which says substance abuse. Now, substance abuse, we have to strengthen and prevention the treatment of substance abuse, including narcotic drugs, harmful use of alcohol. So this is the target given by 2030. Target 3.6 says the road traffic safety. So we have to reduce the number to half of the global deaths and injuries from the road traffic accidents. So these are the, again, targets. Now, out of these 9 targets, last 3 are target 3.7 is sexual and reproductive health. Now, why I am quoting all these things? Because all these targets can be your area of research. That is important for you to understand, so that once you understand what is the target, based on that, you can make your research proposals or you can work on some research article. So target 3.7 says sexual and reproductive health. We have to ensure that universal access to sexual and reproductive health care services, that is including family planning, information and education to all, and integration of reproductive health into national strategies and the policies as well. Now, target 3.8 is focusing on universal health coverage, that there should be a financial risk protection for all under this target. Now, it says that there has to be access to quality essential healthcare services and access to safe, effective, quality and affordable essential medicines and vaccines for all. So this is the target given by 2030. Target 3.9 is about the environmental health. So we have to reduce the number of deaths and illnesses from hazardous chemicals and through air, water, and soil pollution and contamination. Now, there are certain frameworks which can help. Again, they are being considered into the targets only, but these are the certain frameworks, that we can have. Now, the framework says that there are tobacco control we have to consider. So WHO says that we have to strengthen the implementation of the WHO Framework Convention on Tobacco Control. Now, this will again help in achieving one of the 9 targets, at least that has been mentioned earlier. So Framework 3.B says about the medicines and vaccines. It supports the research and development of vaccines and medicines for communicable and non-communicable diseases that are affecting developing countries. Now, Framework 3.C says health, financial, and workforce. Now, we have to increase the health financing and the recruitment, development, training, and retention of health workforce. That is again the framework that comes under the target, which is on goal SDG 3. 3.D says that we should be ready for the emergencies. So capacity of all countries for early warning, for risk reduction, for management of national and global health risks, we have to cover that. Now, in this particular case, we can see that how prepared we were during the COVID times. Okay, so this is again the challenge, because in case of any pandemics and all, every country should be ready for handling such emergency situations. This is again the target. So there are 9 plus 4 targets that have been defined under SDG Goal 3. Now it is up to us that which particular target we can focus on to this. If we see the research part, now once you know the SDGs, there is a specific SDG on which you want to contribute. It can be SDG 3, because I have taken it, considering that the majority of the candidates are from health science backgrounds. So SDG 3 would be of interest to all. Otherwise, if you want to go in for interdisciplinary research, you can focus on any other SDG goal as well. But the process will remain same, that first of all, you need to understand the targets of particular SDG goal. Once you have identified the targets and shortlisted the target that you want to focus on, you will work for the research in that direction. So once the targets are there, you will find on the UN SDG website that there are certain indicators against every target, which tells us that how you can measure that particular thing, that how much percentage of target you have achieved. So we'll focus on to that as well while giving the example to you. So now, when we have to start a research, the first thing we have done, we have identified the SDG goal. We have identified few targets on which we want to work. Now comes the research part, how we have to do the research. Now, there are 6 steps if you go the clockwise direction in the arrow sequence. The first step is identify research topic and define the objectives. Now, when you have to identify the research topic that SDG goals and targets will help, you have to define objectives. Again, you can define your objectives with the help of the targets that have been given by the UN SDGs. Second step under this is the review literature. That means you have to review the literature according to that. Third is identify the challenges in that research area. What are the challenges you are facing? Because whatever contribution you want to give, it has to be novel contribution. You cannot, do the research work which has been done by somebody else. So there were, I think, few sessions related to ethics as well. So we have to stick to the ethics. We have to stick to all other, issues as well. So that means we have to identify our own challenges that we want to address in our research area. So this would be the third step. Now, the next step would be identify research methodology and prepare research plan, which is important, that what kind of methodology you want to work on, how you want to go about your research, and then you have to make a proper concrete research plan for this. Now, this research plan, it is not only when you are doing some project, it is not only when doing your PhD work, it is about any article that you want to publish. Even you have to make your research plan, because in any article that you would like to contribute will have a substantial data that you need to showcase to the various communities. So it has to be planned appropriately. Now, the fifth step would be collect and analyze the data, which is again very important part, that without the data, you cannot do any analysis, and data is very, very important, especially when the data is related to the medical sector or the health sciences data. The last step would be interpret the findings and then publish your data. These are very basic steps, all those who are doing the research might be doing it, but I will focus it on to step by step that how in relevance to SDGs you can do these steps. So if I focus on the first step, which is identify research topic and define objectives. Now we have to identify the research topic. I've already told you that we have talked about the targets. Identify the targets and identify the associated indicators for these targets that you can get from the UN SDG website. Very clearly, it has been given under every goal. You can pick those things for your reference. Now, choose the area related to the pressing issue across nations. Now, there are different targets, but there are few things which don't require much focus, but with the years, with the time duration, it will be overcome with the help of government policies, with the help of other things. But if you want to contribute something into area, then you have to find the pressing issue where a lot of people are also working, and you can get a lot of data, and there is a scope of contribution in this case. So, for example, if I talk of this data, it is under 5 mortality rate, probability of dying by age 5 per 1,000 live births. This was to be achieved in 2030, but this is the data depicting in 2000. So if you see the colors of this, the red part which are being highlighted are important ones, which is ranging to more than, say, a critical range, right? So the focus area there are the 2-3 major parts on the African continent where we need to focus on. For rest of the part, I think 20%, 30% of the nations are already, having very less mortality rate, which may be coming, under this particular the well-defined targets that have been mentioned. So we have to identify an area, first of all, where there is a scope of lot of contribution. If you belong to an area, say Asian continent, if you belong to the Asian continent, you can see the range is 50 to 99. Now there is a scope to reduce that, right? So we can focus onto that, because when you have to work with the data, it would be easier to get the data from a nation in which you are belonging to, rather than getting the data from the other countries. Okay? So if I see another data, it is a global age standardization, alcohol attributable infectious disease death rate. It is by 2016. Now, if you see the data, you will find that lot many countries are affected by that. Not only a particular continent, but almost 70% of the nations are affected by this. So there is the place where you can contribute a lot, and you can do the collaborations with the other countries who are actually working in this area. So chances of getting the data will improve. So focus on the area where there is a pressing issue across nations, so that you can have a good collaboration with the other nations as well. Now, next is we need to identify the gaps in the knowledge, data and interventions that can be done. Always see, when you talk of data and you talk of the analysis of a data, there has to be some interdisciplinary engagement, because some factors may be related to the pharmaceutical, some factors may be related to the machine learning analysis, and also it will be an interdisciplinary approach if you want to work for that. Now you need to define, once you have identified your broad topic for the research, you need to identify the indicators, which I've already mentioned, that indicators are already mentioned on your UN SDG portal or the website that you can focus on. Right. So this was the first step. This is the website you can work on, sdgs.un.org. You will find a publication, drop-down menu over there, where you will find the publications which are actually the reports, the analysis published by relevant organizations which are contributing towards SDGs. So that can be your first source of information, that what are the pressing issues, what are the topics on which people are contributing or the organizations are contributing. So you can get an idea from this particular page as well, on this particular link as well. So I've taken one example over here, again considering SDG 3 and considering the SDG target 3.1, which is focused around maternal mortality. So the target is by 2030, you have to reduce the maternal mortality ratio to less than 70 per 1 lakh live births. So that is the target. Now, there are indicators given by UN. Again, there are two indicators: maternal mortality ratio, and second indicator is proportion of births attended by skilled health personnel. Now, why it is important to understand these indicators? Because a lot of organizations are contributing to improve on these two parameters. Basically, they are these two parameters on which you can focus on, and you can get the relevant data related to these indicators as well, because otherwise it becomes very difficult. So indicators are that you can get the data, you can get the reports related to these two indicators, which can help you in your research. Okay, so that is the purpose of having the indicators. So every target, every goal have few targets, every target has indicators. Okay, so you have to first identify goal. We have identified goal 3 over here. Then you have to identify the targets. We have identified target 3.1. Then you have to check the indicators for that particular target. So there are two indicators that we have mentioned: maternal mortality ratio and proportion of births attended by skilled health personnel. Right? So on my right side, you'll see goal 3. Ensure healthy lives and promote well-being for all at all ages. So it is showing us that there are 13 targets which we have already focused on, which is 9 plus 4 targets. 48 events have been already done. There are 47 publications which are listed on the UN SDG website only, and 1 to 8 actions have been taken by the organizations to contribute to this particular goal. Okay, so this is the statistics. This all you can get from the website. Now, example topic I have taken, because now we have identified the goal, target, and the indicators. So to start with, you can start by doing a comparative analysis. That is the first step in the research, right? So you can work on topic I had thought of, that study of factors affecting maternal mortality, a comparative analysis nationwide. So this can be your topic of research. Now, you need to have the data for that. For every nation, you need to have the data. And then you can do the comparative analysis of what are the factors which are affecting maternal mortality. Now, you need to identify the factors, and then you have to see that how other countries have improved on it and how those factors will impact the developing nations where we need further improvement. So a lot of things can be put under this comparative analysis. So comparative analysis is kind of a basic, the first step of your research when you focus on certain SDG target. And later comes, the actual contribution, actual research work. Here it is just a literature survey and an analysis for the understanding purpose and identifying the challenges further. So now, second, in research, we talked about 6 steps. The first step we have already discussed, how to identify the research topic and define the objectives. Now, second step comes review literature and related topic. Now, when you have to review literature, how will you review the literature? There are certain websites which are available. I have put one, say websites over here from where you can get the data, because you need to have the data and the reports to check that what has been done in this field. So there are certain websites I can open for you. This is the World Health Organization, WHO. Now, are you able to see the website of WHO?
Yes, ma'am. Yes, ma'am.
Yeah. So now, if I see the World Health Organization, you will find certain indicators, you will find certain countries, you will find newsrooms. Now, here on this, you will find WHO Home. There are certain indicators you can find, there are certain countries, there are datas, there are map galleries available. So everything can be accessed. The maps that I had shown to you, I have taken from here. Right? You can get the maps from under various topics that you want to focus on. So this map will give you a way that on which issue you can further focus on. So if I go to the indicators, there are certain indicators. Now these indicators are different than the indicators mentioned on the SDGs website. So you can search for the indicators. Say if I want to search for, my indicator is maternal mortality ratio. Okay. So I check about this if I have some indicator available or not. So if it is there, we will get the details for that. If it is not there, then obviously we will not be having any details. Okay. So if I talk of the say data API, there is one data API, that is GHO OData API. Okay. So we can pick the data from here as well. Now, if I go to the next one, there is a data available. Now, this is the World Health Statistics. If you want to see the data, which is World Health Statistics 2024, monitoring health for SDGs. So if you download this data, you will get the data of different nations, right? So there would be plenty of records available. You can fetch the record of a particular data. So these are the data points that you can collect. You can get it in the Excel format as well. I'm not downloading. You can just see and check and download the data, because there are 50 health related indicators, that have been mentioned over here, okay, which are from SDGs. Okay. So you can download this data and you can find the details into that. That will be your starting point. So if I go to now, WHO is one particular source from where you can get the data. Under that, Global Health Observatory is there, which is providing you all the articles, data, and providing you the pressing issues and the topics as well. United Nations have got another website. So you can go to the UN website as well. So here is the UN website where you will find the themes, which is a mortality. There are data and facts available. You can got the World Mortality 2019 data booklet. The latest would be available over there as and when they are uploading it. Mortality estimates and projections. Now, these are the data which are authenticated data, which is giving you the true picture. So here you can find on the second, this column, publications. You can find the publications related to this. interagency child and maternal mortality estimates. So these are the authentic reports which have been provided either by WHO or by UN or by UNICEF, which have been quoted over here. So all these reports are of use to you. Now, there are certain events which are dedicated going on under this. So you can work for these. You can look out for these events also. Now, why these events are important? Because you can have a good collaboration among other people who are working in this area to have a peer group, working, contributing to the same SDG. So these are the websites. Again, there is one more source from where you can get the indicators, which is a World Bank. Right? World Bank actually gives you the data, which is a financial part of it. Now, when there is a certain issue, a pressing issue, obviously more funds will be allocated to that. And if there is a progress, more funds will be consumed onto that. So this is again one of the indicators. You can go to this website as well, where you can check from the what are the world development indicators. Now, there are certain databases available that you can work on. There are maps available. Now, maps are related to various countries, so you can focus on various countries and you can work in this direction. Say, for example, if I want to select any country, so I can do that. We can get the table, maps, or charts of these particular countries, of whichever topic you want to, of whichever indicator you want to focus. So there are further download options are available to you, that you want to download it in an Excel format, or you want to have another metadata, and what else. So database says that there are 86 databases and there are 266 according to the country. Okay, so all these tables can be downloaded. So you can pick any of the country and you can customize, also create a custom group. If on the left, if you want to do the study of various countries at one go, if you want to do the study of say Asian countries and this, so you can select these particular countries as well. Okay, so say for example, you can create a custom group. Right? So if you can create a custom group, then you can see the charts and the metadata. Okay. So this is how you can proceed on to this. So these are the data sets that are available for you. Metadata will be there, map will be there, and then you can focus on the countries, enter for keyword. We can do that. Say, okay. So probably if there is data available, it will show me the data. There is no custom group that have been defined, so maybe you can have to download it individually, and then you can do that. So there are 4 countries, but if I have taken this one database, so 4 countries have been selected, but there is no data available which is a combined data of all these 4 countries. So what we can do is we can identify the single country, and then we can do our own data collation. So that will help us out. Now, if I go back to this, now these are the certain sources from where you can download your data. And now once you have downloaded the data, so you have get the latest research articles from the sources. PubMed is one of the resources from where you can get the data. So I put here a snapshot. You can search for maternal mortality and you will find a lot of, this, papers. Now, Google Scholar is again one of the options. Web of Science is another option where you can find the articles related to the particular indicator that you are talking about. Now, keywords are very, very important for metadata search. You can use the specific keywords like maternal mortality, factors affecting maternal mortality, etc. It cannot be a sentence. The keyword has to be very, very specific so that you can get a specific results. Otherwise, the results may not be valid as well or may not be useful for you. So first of all, identify the keywords which you can get from the indicators as well, and which you can get from the targets as well. So this is how you can work on this particular field. This was the second step, that we how to get the data. Now identify the challenges. Now once we have understood the research topic, we have to find the challenges into that. Now challenges are important. If it is a comparative analysis, people must have done the comparative analysis earlier as well. So what is new that you are contributing? So you need to identify some challenges of previous papers which are related to the comparative analysis of mortality rate. Okay, so once you have identified the challenges on the existing papers, now existing papers have to be the latest papers. You cannot, have the comparative analysis paper of year, say 2005 or 2010 or 2015. You have to have the recent papers. Okay, if there is no recent paper, then your challenge is that no one has given such kind of analysis in past 5 years where the data has already changed. Okay, so that can be the valid reason for your research. Now once you identify the challenges of the recent paper, that specific author has given the comparative analysis, but these points are missing. Now what can be those points in the comparative analysis? If it is actual research work or simulations, you can show that it is your unique work. But if it is a comparative analysis, then you have to have a valid reason that why you are doing this and what is the novelty in your work that you are putting. So there are few things that I have collated. Understand the context and culture. If I'm talking of, again, the maternal mortality, now specific contribution would be from culture. On what context we are doing that. Now every country has got a different culture, rituals, and different policy matters as well, right? So you need to have the knowledge of all these things, that why we are doing that, why the mortality rate is more in one country or why it is less in another country. It can be cultural reason, it can be a geographical reasons, it can be on a different context, which can be political or socio-economic or whatever. So that you need to identify what is it basically. Right? So that will be identification of your challenges. Now check for discrepancies in data collection. It is important. So some authors must have collected the data, but there may be some variation in the data. If I talk of the discrepancies, that means the data may not be recent, the data may be biased, the data may not have the data of all the countries. It may be focused on certain developed nations. It may be, focusing on only, say, 10% of the nations, but not all the nations, right? So that we need to check. Avoid inconsistencies and biases. Now, we always talk, when we talk of data, we talk of the biasing in the data. Now, why it means it's a biased data? Say, obviously, if you get the data of a particular nation and in a particular year, which data is good, then there is not much scope, to work in that direction. But if you're projecting your data to be very critical and the figures are very low, right? So that means you can always say that there is a scope of improvement. So there should not be any biasing. In case of this particular topic that we have taken, which is a maternal mortality, the bias can be you are taking only few countries and leaving the rest of it. So your data would be biased. You are taking the data from a country which is having less population, so that you are only having a data which is of say 10% of the population, and you are leaving 90% of the population for that. So that means again it is a bias. There can be inconsistency in the data. That means certain continents you have picked and certain you have left. So it should not be done. When it is a comparative analysis nation-wise, then you have to have the equal set of data from all the nations. Say, for example, if the population is, say, 1 lakh, so you have to have the data of at least 10% of the 20% from that country. In some countries where the population is more, it is 10 lakhs. Then again, the percentage have to be same. It's not that a country with the lesser population you have 100% of the data, but a country which is having a more population, you are having only 10% of the data, right? So data has to be spread across population. So that you have to focus on. Now there is data standardization. There are certain factors which are not standardized. It is difficult for us to obtain because some particular country may have this mortality rate with the different parameters. Some countries may have with the different parameters. It may be having age of say these many years from age A to age B. Some countries may have the data from age B to age C group and so on. So that means we have to have certain standardization. Now, how you can get the standardization? If you are getting the data from some resources, they may have their own set of data, but if you are collecting it from WHO, from UN, from World Bank and all, so they have standardization. They have aligned the indicators accordingly. So and they map the data of every country with that indicators. So your data has to be standardized because it is very, very difficult to do it manually by your own self. Okay, so you have to have the data which is standardized. Then the sanitation is important. The data which is not required and the data which is critical and should not be handed over to anyone and should not be assessed by public. So that needs to be destroyed and removed. Okay, so that is the data sanitation. It is a very valid term when we talk of the machine learning models and all when it comes to analysis of a data, because the data which is not to be shown to others, it is critical data. So then we have to remove that particular data. We have to destroy that particular data so that it is not in the hands of any other person. Sampling of data is important. Again, if you are taking 1 lakh of records overall for your research purpose, it should depict the equal percentage should be contributed by all the nations because it's comparative analysis nation-wise. So if it is a 10%, then 10% of total 1 lakh records should be contributed by all the nations. That is the sampling we need to focus on. Okay. And at the end, ethical considerations are must while collecting the data, while putting the data, while doing standardization, while doing the sanitation. So we have to, consider this ethical factors. Now, the fourth step in our research is the research methodology and research plan. So how you can prepare the research methodology and research plan. So if you see on the left, there are research methodology steps, very, very simple. All of you might be knowing it. Literature review, data collection, identify the influencing factors. Then you do the statistical analysis of data, use any tool for that, preparing comparative framework, and then data visualization in the report and in the article. Then when it comes to research plan, foremost important thing is that you need to prepare your timeline because no research can be done without timeline, even if it is a research publication, if it is an article publication, again, define the timeline for that because it also includes a lot of work. So next thing in research plan is data collection, then data analysis and data interpretation. So I have shown a timeline, a sample timeline for this. If you identify that you have to complete it in 5 months, maybe you can put it in the number of days. I have put it in the months. So I have specified a particular month, but otherwise, in general, you can put number of days, that 30 days for this work, 30 days for this work, and 30 days, and then you can, make your timeline. So if you see this timeline, on the column headings, you have time duration, and row headings, you have research plan. Now, in the research plan, you have literature review. A literature review will continue till the end, because the moment you are doing research, you are collecting, understanding the topic, you are defining the objectives, identify the challenges, then you do the data collection part, you check the data, validation is done. So all these requires literature review, because even if you are using a certain tool for analysis part or other things, so that tools also need to be studied, that why you are using such a tool, why you are using a particular tools, because there can be a biasness created by the tools as well, right? Like you have calibrations of the equipments when you do the testing, in the labs, blood tests and all. So there are calibrations of the machines and all, which is important. So now when you are talking of the calibrations, that means what? The calibration may vary. Calibration of the machine may vary. So that time also you have to do a lot of research. So when it comes to the statistical analysis, you have to study the tools which are the perfect tool for giving you the analysis, giving you the results. So your literature review will continue towards the end. Data collection part, once you have identified the research topic, identified the objectives, then the data collection starts. So that is why it is for 3 months it has been done, that July, August, September, you can have the data collection. Then data analysis. So now, once you have collected the data, once you have checked the sanctity of data, then comes the analysis. Okay? So 2 months we can spend on data analysis, then data interpretation and report. Once you have done the data analysis, then interpret the data and generate some report. And towards the end, there is a skill enhancement on tools and technologies. So that will start from the very beginning, because if you have to search a topic or you have to write a report, there can be certain steps involved into that. So all these will be adding to your skill enhancement, and every time you will be learning something new, every time you will be requiring some maybe sessions or the workshop, or maybe some help to understand those tools and all. So skill enhancement will start from the beginning of research and will end with the end of research only. So every research is enhancing your skills on different tools, technologies, on how to write, how to collect the data, how to define your research objectives, and also everything is skill. So that will be throughout the timeline. So these are the hypothetical months I have given, because the study we have taken is a comparative analysis. So a comparative analysis may take a lesser time, but then you can define your own timeline for any particular thing that you want to do, which is important. So even if it is a research paper, make a timeline so that you are able to finish your work well in time. So the fifth one in the research part is, the fifth step is collect and analyze data. So now data collection can be done from existing databases. I have already shown you a number of websites. Data collection can be done through surveys as well. But when you do the surveys, you have to be very, very specific that data should not be biased, because you will be getting the surveys from a particular area, from a particular geographical location, or from a particular community. Okay? So you have to be very, very specific that whether you will be getting the unbiased data from your surveys or not. Then you can get it through reviews. There are certain reviews posted by different agencies. From that reviews, you can get the data collection. That is also one way of doing that. Next is data analysis part in this step. Now we have to analyze the data. Analysis is important, because you need to understand that how your data is different, related to demography, related to geography, related to socio-economic factors. Like we have a simple categorization, developing nation, underdeveloped nations, developing nations, and developed nations. So if you are focusing on that social economic factors, you should know that how much percentage of your data is from which particular, variable. Right? So then do the qualitative analysis of your data, how your data is good. A simple example is I'm taking say I'm taking a survey on one particular thing, that have you got any problems as such, have you got any medical problem in past 3 months. So the people, no one would like to disclose, everyone will say no, no, no. Are you happy? Yes. Are you happy with the FDP? Yes. All the sessions were good? Yes. So sometimes, you have to see the data and do the analysis whether the data is correct or not, whether the data is actually a quality data or not, right? Sometimes we get the remarks from everyone. Like if it is a feedback, we ask the persons, give your remarks, because somebody who's writing certain points, we find that, okay, that person must have filled the survey of the form very carefully. That is why the person is able to write few points. So you have to check the quality of the data as well. Only then you can do the qualitative analysis of the data. Then how you can analyze the data? You have certain machine learning models for which you can take help of people from other streams. You can use a simple MS Excel tool. You can use the Google Sheets. We all have been using it. So there are tremendous options available for analyzing in MS Excel and Google Sheets. You can use a Weka tools. You can use RapidMiner and K9 tool, which are very, very user friendly. You don't have to be a programmer or a computer science background, or you should not be good in coding. It's just a user friendly tools that you can simply use. If you want to go in for the advanced machine learning tools, you can go for the Python programming, whereas different libraries are available. Keras is there, PyTorch is there, Pandas are there, which can be of use for analyzing data. But then you should have a skill for that as well. Otherwise, you can take the help of your peer group who are actually, working in this field. Okay? So that is the step when you have to collect data and analyze data. Now, the last step of the research is interpret the findings and publish, which is important, because whatever work you have done, how you are interpreting it, how you are putting it, and how relevant your findings are to the others. Okay, that is important. So when you have to interpret the findings, identify key metrics on which you want to interpret your result. Like my analysis will help in this way. My analysis have identified that this is the factor which is affecting 90% of the say maternal mortality rate. So these are the key metrics that you need to identify. Then compare the findings with earlier published articles on the topic. If somebody has done the comparison earlier, you have to compare with that paper, that how your paper has overcome the challenges that have been posed into the previous one, or what additional things that your research paper or research article is given. So you have to compare your findings of what has been posed earlier. Now, data validation. Every time you have to check for the data validation, how you can do the validation. If somebody has said that, okay, say for the maternal mortality, the say 10%, 10% of the data says that it is malnutrition. Okay? If that be the case, but in your analysis, you are putting that it is 90% of the cases, it is because of malnutrition. Now, if the earlier paper has put that only 10% and you are putting that it is 90%, that means there is a mismatch. The data cannot be from 10, it cannot be a 90%. How one factor can be so major factor? Okay. So in that particular case, you need to check. First thing is the previous paper that you have quoted, whether it was from the good journal publications that you have to identify, because their data would be quite authentic data. That is what we consider. Okay, so you have to validate your data with the previous findings. Okay, and the previous findings themselves have to be very, very good from a good resources. That is why we say take the data which is unbiased, take the data which is authenticated. So if your data is biased, definitely you can get the results, okay, that it is 90% it is due to malnutrition. It may be so that you have got the majority of your records were from underdeveloped nation or the poor nations where there is a problem of the malnutrition. Okay, so then your results will also be biased. So validation is kind of giving you inputs that how you can uh, check your data, how you can check your results. Then, if you have to publish research, identify good journals, prepare the manuscript as per the format that we have been doing it, submit. Then, if you have got the revision, revise it, and then resubmit and keep on doing that. So, this is a general process that we have done. So, I've covered the all the focus areas of your research that are important to us. Now, how you ensure that you are contributing towards SDG? You have identified the topic which is related to SDG, but how your research will come on the SDG search, that is also important. Always focus on targets of particular goal and the indicators. Link your findings towards improving the indicators. Now, if there are two indicators that we focused on while doing the target 3.1, so your findings should always depict the graphical analysis or any other analysis on those two indicators, that our data shows that, okay, 10% of maternal mortality is due to this, and maybe a second indicator. Based on that, you can again, give your analysis of your paper. You can cite related SDG in your article. There is a provision that you can cite a particular SDG as well, giving the reference of the UN SDGs. You can cite a particular SDG so that while searching, your article can be searched through the SDG as well. Now, there are certain keywords that have been specified under this SDGs. So identify those keywords and use those keywords in the text of your paper. You can use it in the abstract, you can give it as a keyword, you can use it in the text as well. So that whenever there is a searching related to SDG targets, SDG goals, your paper can be found by the peer group, by the researchers. Collaborate with the organizations working on SDGs. There are certain organizations who are already working on the SDGs. You can find it from here. I will show you the result. So there is one portal which is sdgmapping.ch. Now you can filter the organization, you can do the mapping. Say if you filter, you can find the contributing organizations. So targets of all SDGs, you can find the different things over there. So say if you filter organizations, find contributing organizations, you can do that. Choose the goal. You can choose the goal 3, and there are certain organizations you will get. So these are the organizations with which you can collaborate, with which you can collaborate to get the results, and with which you can collaboratively work to attain those targets as well. So this will give you an organization. Choose the expertise. You can choose the expertise in this area, that who all organizations are working in capacity building and training, who are doing for the coordination or the mediation for a particular thing, who are doing data analysis and harmonization, who are doing operations in the field, who are doing legal frameworks. So if I talk of research and collection of data, you can find the organizations under SDG 3 who are doing the this research and collection. So you can approach any of the organizations who are actually doing and can take their help as well. So SDG mapping portal can be used. Now, there are Scopus resources also available. Now, Scopus has started one initiative, one additional, the resources in which they mention for against each article, they mention the SDGs as well. Okay, so if university has got university login, so under that login, university can find that how many papers were contributing to which particular SDG. How that will happen when you are focusing the targets and indicators of that SDG. Once you are linking your findings to improve those indicators, you are citing the SDG or you are using the keywords related to SDG. That is how your research paper will be counted contributing to a particular SDG. Okay, and Scopus is giving you the facility to check that which all particular papers have been published by researchers from a particular higher education institute and how many are contributing to SDG 1, 2, 3, etc. So this data is also available to all of us. But otherwise, it is very, very important that we all should work to attain the SDG goals as well. So that was all from my side. The important thing is that we all are talking about SDGs, but what actually are we doing to improve on those or to achieve the targets is important. So it requires a lot of study, a lot of inputs, and a lot of methodology and correct approach to work for the achievement of any particular SDG. So that is important. So you being into health sector, most of you are from this side. So which is very, very peculiar, SDG or peculiar goal that we have to focus on. So when you contribute in this direction, when you plan your research in this way, definitely you can help to, achieve a target. You can help the UN, to attain the SDG, or you can help your nation to attain that particular SDG goal and achieve that target.